far. It looks like maybe just us here in the room. Anyway.
Okay, you're live.
We're live? Great.
Live.
Thank you, Belchertown TV. Welcome, everybody. This is the Monday, February 24th, 2025, meeting of the Belchertown Opioid Settlement Funds Advisory Committee. Glad to have folks joining us today. A couple of things that we'll do initially. So I'm Gail Grammarosa. I'm currently serving as the chairperson, volunteer chairperson of the committee. And welcome other folks.
Sorry, I got lost.
You got lost.
I went upstairs.
Oh,
Like
no worries.
mentally or physically? No, I'm just kidding.
It's Monday, and I know for some folks, school vacation week was last week, and maybe other vacations. Anyway, so welcome everybody. So I'm going to officially just call the meeting to order. Based on that clock up there, it looks to me like it's about 10:03. And then we'll do some introductions as to who we all are, committee members. We have guest speakers today, other guests who are with us, and then we'll move through our agenda. There are a few copies of the agenda right there if anybody wants. And I've got an additional copy over there at one of the seats if you want to take a look at a copy of the agenda. But the bulk of our meeting today is with guest speakers to tell us about some work they're doing around social work and health departments. I do want to say before we go through the introductions as well, in addition to the folks we have here from the Milltown's Public Health program, we were hoping to have Liz Plouffe from the East Hampton Health Department. You may have seen the email that she is in court this morning. She's doing her work as a community social worker helping someone with a housing challenge. So she texted me early this morning. She thought if they were quick enough at court that she might be here, but it looks like the court is very busy this morning. So she will not be with us today, but we're talking about a plan where she might be able to come to a next meeting. So East Hampton Health Department won't be here today, but like I said, we've got folks from the Milltown's Public Health Project. So let me stop there, and again, we'll just go around, maybe introduce everybody who's in the room. So not only for BCTV, I'll keep an eye on anybody coming in virtually, and then we'll all know who everybody is. So I'll start here, and we'll just kind of wind our way around.
Hi, I'm Kim Dewey, pediatrician and boat representative on the opioid committee.
I'm Jill Rossi. I'm the town accountant and I don't know what representative.
Other community,
all of the above.
All of the representative, the person who is
Almost all of the
vital when it comes to the money part of it, along with your own experiences and work around substance use. So we're happy to have you, whatever hat. I've already introduced myself. I'm Gail Grammarosa, and I guess my official thing is I'm like the community member, I think. The committee has different titles that are sort of designated as a 7-person community. So
I'm the Chris Hogue, Program Director of Drug-Free Communities and co-chair of BOAT, which is our town coalition, and school representative.
Hi everyone, I'm Emily Kirby. I'm the Director of Prevention and Community Health for the town of Ware, and I oversee Quabbin Health Substance Use Alliance, so I'm the QHSUA representative.
I'm Neil Oger. I'm a sergeant with the Belchertown Police Department, and I represent the public safety part.
Lauren Kelly, she, her, and I'm the New Hampshire Hope Coordinator based out of Northampton, DHHS.
Hi everyone, Taylor McAndrew, also with Northampton's Department of Health and Human Services.
Me? Okay, perfect. My name's Erin McMurray. I am the Shared Services Coordinator for the Milltown's Public Health.
Hi everyone, Ashley Jenny, Shared Services Social Worker with the Milltown's Public Health.
great. Welcome to our folks from the countywide services. Lauren, I think we saw you last time on Zoom, so nice to have you here in person. Taylor as well. Feel free to move around, do whatever. So as noted, most of our meeting today is to hear more about what the Milltown's Public Health folks are up to with respect to providing social work services. So I think I'm just going to turn to you all to kind of tell us a little bit. And then without East Hampton here today, I think we'll have plenty of time for comments, questions, any further information, other suggestions that you have as well about how we can learn more about this model that Jill brought to our attention at our last meeting. So take it away, Milltowns.
You go first.
Yeah, Erin will go first because she'll talk about like the logistics side of things and our grant.
Yeah.
Beautiful.
So
Thank you.
we are part of the Public Health Excellence Grant. So we cover Ludlow, Palmer, Warren, and West Brookfield. We sit in-house in Ludlow, in their health department. So Ludlow's the community host for the grant, so therefore we sit with them. I started last March, so it's almost been a year, and then Ashley was hired in May. So we're all still very, very new. I'm trying to think. She works really, really closely with the police department and fire in Ludlow specifically. We've done different events and gotten involved. I'll let her talk more about that. But that's pretty much all I have.
Yeah.
That's
I think just like we are under the shared services grant through DPH and Public Health Excellence. But I'll talk about a little bit of my position. If you guys have any questions at the end, let me know.
Sure.
So ultimately, my goal is to connect individuals to residents. So wide range of services and supports, substance use, mental health, housing, transportation, elderly supports, food resources, health insurance. Every day is different, so it's just trying to figure out what the need is. A big part of what I do is I meet weekly with the Ludlow Police Department and the Ludlow Fire Department. So with them, we meet Tuesdays and Thursdays, and we go over calls that they have gone to, and then I follow up on the calls. So again, it depends on what the call is, if it's substance use related, if it's mental health related, if it's hoarding, housing. I try to reach out to the resident and see if I can provide any supports. I do drop-in hours at the library in Ludlow, so that's once a month, the first Wednesday of the month. So individuals can meet me there. I give out little goodies. So Erin puts a lot of little goodies together. So kind of just, COVID test, Narcan, little pill containers, anything you can think of, we try to give out. We do a lot of community events, so just trying to be present in the communities. In the West Brookfield, we always go to the farmers market. In Palmer, they have the Community Strong Wellness with Sergeant Burns and Dart. So they do that with a bunch of different...
At their library.
Yeah, I think that's every other
library,
Thursday.
yeah.
So just trying to be present in the community.
This past year definitely has been us just getting word out there of who we are, because no one was in these positions before us. So it's a lot of community building, going out, introducing ourselves, saying like we're here to help, and just kind of taking it from there. I had another point I was going to bring up.
Good plug for the Umbrella Wellness Fair, isn't it? Yeah, we'll have to talk about that after.
I know.
Oh, yeah.
I know Ashley met with a lot of different social workers that were like in very similar positions when she first started this job. So she met with Liz, and something that Liz had told her right from the beginning was she tries, and I'm sure she'll say it when she meets with you guys, she tries not to duplicate services. So really, if there's already CHD in the community, not duplicating what CHD is doing, trying to find different resources, trying to be a different person who's offering different not to repeat the word, just resources to community members. Because if you have, 10 of the same people, how productive is that really? So
Ludlow has a really good relationship with CHD. They don't have like a clinician with the PD or anything like that, but they have a good relationship. So I don't do any counseling or therapy, anything like that. So I'll refer to CHD. I have direct contacts that I reach out to. So if a lot of times if it's behavioral and mental health, I'll reach out directly to them, and we'll work together in following up with the individual. Again, not trying to duplicate efforts. They already provide the services and they're in town. Just reaching out to them. I'm trying to think. I do home visits, so if individuals, I'll go to the home. I'll meet them in the community, wherever they want to meet, if it's appropriate. Yeah, I work closely. So with substance use follow-ups, I'll go out with Tapestry Health and a recovery coach. So we'll do that. I know you guys are probably familiar with the post-overdose outreach kind of model. I'm trying to think. Working with like the senior center, so sometimes I'll get individuals that are elderly. Some individuals don't like the senior center, or it's just not for them. So kind of working with the outreach coordinator at the senior center, and again, trying not to duplicate efforts. If they're already working with the individual, I don't want to come in and do the same exact thing. So asking questions like that when I'm working with individuals. I'm trying to think what else.
We recently got nalox boxes installed in Ware and West Brookfield, so we worked really closely with the PD and the Board of Selectmen and the health departments over there. Ashley does all of the reporting on that, so Ludlow was a part of a community naloxone purchasing program, and they had written in the other towns when they applied for it. So we're now able to offer Narcan throughout all of our communities through that program, but there were previously no nalox boxes installed in those towns.
Sitting out of the health department, working with the health inspector too. So if they have to condemn any housing, working alongside with the resident, trying to help them, support them find housing. So that's another role, just being in the health department, kind of working with the health inspector, and the health director.
Ashley's definitely a jack of all trades. I feel like there's not really a whole lot that she will turn down at the end of the day, and considering she hasn't even been in a role for a year yet, I can't even imagine what it's going to look like a year from now. So, food for thought.
I guess, also, like, Ludlow has a CARES coalition, Ludlow CARES coalition, so I did a little community television episode with them, just explaining my role. So I think, kind of like Erin said, like, this first year is really about, like, getting the word out and, like, having people know I'm at the health department, I'm in the communities, the 4 different communities. Also, the 4 different communities are so different, so what works in one may not work in the other. Warren and West Brookfield are a whole different county, so it's a little different being in Worcester County compared to the Hampton County. So, I guess we kind of rambled, but if there's any direct questions.
I did.
Super helpful. I know I have questions. You have stuff to share.
Bring some handouts. So we months ago put together these like little cards that I try to post them wherever. That just talk about what Ashley does, so someone can kind of grab and go. I post them in like laundromats or at the libraries or wherever. And then additionally, we recently put together, and I printed out 3, so I apologize. But some statistics of the work that Ashley's done. So these are referrals only. It's not including like the work that she does, like the follow-ups that she does with the PD weekly in Ludlow. But anytime anyone has reached out to her or called her specifically, like having a referral, that's what this represents. And again, mind you, she only started in May, so it's from May to December for 2024. But we have the number of referrals, where the referrals came from, their sex, what they were looking for at the end of the day, and then their age as well. So it's a nice little data spread.
Beautiful.
Yeah.
And I guess also I don't usually ask like for individuals' age or like their sex, so it's like a lot of the information too may not be on there. A lot of times too, people will share directly where they got my information, but sometimes they don't, and depending, I don't want to pry, and kind of, so I kind of, some of it is, not all there.
Great.
I guess also I could mention, like,
helpful.
I have on the Ludlow Health Department, the website, there's a Milltown's Public Health section, and there's a social work tab, so I have a bunch of different resources on there too, so if people, don't feel comfortable calling directly or meeting with me, they can kind of go on there and see the different resources around, so.
Where is that found?
The Ludlow town of Ludlow website, under the health department, there's a Milltown's Public Health tab.
Alright.
I know the Quabbin Hills has like their own webpage, and it's beautiful, and maybe that's something we should look into in the future, because I feel like it's a little hard going through the Ludlow specific website to get to it.
We worked with Envision to help us with that.
Just gonna food for thought. I might reach out to you about that later.
Have you guys come to any of our meetings and presented on what you do? Because our towns do overlap.
Yes, I think I have attended a meeting. I don't know if we've presented. It's been a hot minute. I feel like there was a minute where we were presenting in so many meetings that they're all starting to like blend together. But I'd be more than willing to
we can connect
present.
on that, definitely.
Yeah, absolutely. I know Kirsten. I reach out to her all the time, and she's great. She really is.
She might be here because they're doing the blood drive.
I did see her in there.
Did you?
Yeah, I did see her in there. I don't know if she's still here.
I saw the blood drive police state car.
Right,
Oh, that's what it is. Oh, okay. They're doing
$10
blood drive?
for a gift card,
Yeah.
right?
Oh, free blood.
Give them blood? Yeah. Is it right here in the building?
Yeah.
Oh,
I walked right by it and I was like,
Right next door.
The,
and then I realized it was a blood drive. I was like, oh, this is
auditorium.
and I'll pass out.
Auditorium?
Yeah. I'm right there.
So, do you guys have any questions for us?
This is lovely. I know I do, but I want to give my committee members opportunity first.
I think for me the biggest hurdle or the biggest question so we're the opiate settlement fund committee people, and we're the ones who recommend to the select board what we think that funds should be spent on in order to help our community. So what you guys do is great and amazing, and what I'm trying to figure out in my brain is how do we make our funds then turn into that, and is that where all the funds should come from? It's, you guys aren't just doing opiate stuff. There's all these other things. So is this only our role, or is this something that the town and other towns maybe do? That's what I'm struggling with. And so I guess I'm wondering how this structure, like who made you guys a thing, and who's paying for it? Like how does it come from all the different all the different towns and
so we're grant funded through the state, the Public Health Excellence Grant, which is set up for the next 10 years, as far as I'm aware, as of now.
Which our own local Quabbin Health District also has a public health excellence grant, just so people know that.
Does Belchertown know anything about this?
What do you mean?
Like the public health excellence grant?
I
like
know,
that we
Kristen,
applied
I
or
think we have one somewhere within the district, but I'm not sure.
It's with Belchertown, Ware, and Pelham.
Okay, so that
It's a shared services agreement grant, so the three towns can,
Right. Yeah, because we have like overlap with Ware on a lot of stuff, so it's wicked confusing because like you don't cover Belchertown,
Correct.
which is odd because Palmer's right there, Ludlow's there, then Ware. We're like in the middle.
And it does get confusing, and I feel like people will often reach out in these other communities to Ashley, and we're very strict with these are the towns that we work in.
Right.
So these towns came together, someone had applied and written for the grant. I don't really fully understand, it was before my time,
So-
why these people were grouped together, but they were. Yes.
Yeah. So with that being said, then can we? What money is being used out of that grant?
yeah.
And could that grant cover the position for the other towns? Like, I mean,
I think that's a question for
because
Andrea and
you have your
district-wide
grant's
board.
covering Ware, right?
No.
No.
Oh, okay. So then
No.
that's where Ware could come in. You
Yeah.
guys could cover us and Ware.
Yeah.
But if they're coming under that public health excellence grant, why
It has
can't
to
this
come under
position
that.
come under that grant?
Yeah, I mean, it definitely could.
I mean, I'm just saying, or we could mix the two together.
Right, and maybe some of our funds
Right.
help cover
Cover
some
some
salary of somebody.
And definitely something that I've been thinking about in preparation for this meeting was, I guess at the end of the day, because we're on the board for the Palmer or opioid abatement settlement funding, so I am familiar with this, all of this. But at the end of the day, if they're only being funded through this, who's going to be their supervisor? Like, would it be you guys? I feel like they would probably have to sit
They'd have to sit
with
somewhere.
someone else. I feel like in the long term of things.
Right,
Um,
and it
how
would just
many
be
years?
Belchertown, right? If the Belchertown opioid fund if Belchertown, if this fund recommends to the select board to create this position, and it's only coming from the Belchertown funds, then it should really only cover
It's
Belchertown.
only going to cover
Which I think is a miss. I think there are some. I think this model is beautiful to have some different communities and have resources and other. Not every little town has all the resources. It might be that somebody from Ludlow needs something that's in West Warren or vice versa. And so I like that there is this collaboration between the towns, but I don't know how we just fund. I think we could.
I'm not sure. Yeah, I'm not sure that we could. My feeling would be, if this is a model after today and talking to East Hampton, then we have to talk to the Quabbin Health District, and it has to almost be.
We should get
And then they
managers
have
in
to figure out, are there other towns, like you are now multi-town.
Yeah.
Quabbin Health District has been multi-town for decades now, so I agree with you that we only
And maybe there's
advise on
something where
Belchertown,
Belchertown pays for a bus that you drive between towns to do your work, or Ware pays for some other portion of whatever need is
And
needed in a grant. I don't know.
think that using these funds to help with the salary is unreasonable. Like, to me, that makes sense.
Yeah.
If you wanted to look at that, or even cover like the benefits portion.
Sure. Right.
Whatever.
Right.
And I'm
I
sure
don't know.
Ware would split costs too with their opioid abatement funds.
right,
Yeah.
if
That's
we-
what I was gonna
Oh,
say,
oh,
is
yeah.
like what we could, if we're only doing Belchertown and Ware, then the two towns can come
Yeah.
together with their funds,
Under
and
the
on
existing
top of it,
umbrella.
if you have monies from that other,
Yeah, exactly.
excellence fund, then we could definitely put
Yeah.
this all together, and
Right.
have it cross over towns.
I was curious if you guys were conjoining funds with any other towns. Or
Not
We
at
haven't
the
yet,
moment,
we
no,
haven't yet, but
not
that's
yet.
definitely something we've talked about.
It's
You
not
know,
off the table.
Right, no, we would absolutely be open to doing that for a shared position of some sort that would cover both towns, yeah.
And the
Or
select
multiple
board
towns.
appears to be open to that idea, depending
Yeah.
upon the nature of
And I can see
what
where
it
it's-
is. We've also been talking with Quabbin Health District and QHSUA are also looking at the idea of some shared collaboration around harm reduction, like mobile harm reduction,
Yeah.
which again, I think would involve mostly Belchertown, where Pelham obviously is a part of the Quabbin Health District, but there's, it's a much
Yeah.
smaller town with a little less activity going on. But doesn't mean they couldn't be involved either. Residents of Pelham might have needs
Yeah,
around
absolutely.
And I
social
could see
work.
them throwing in
as well.
what they have for opioid abatements, because I know they were trying to figure out what to do with them.
Right,
So bringing something to them,
right.
such as this, I could see them going for.
And just so that I'm clear, it sounds like Public Health Excellence is funding 100% of your
Correct.
position?
Correct.
Just as an example, when you look at the sample from, I think it's from Liz Plouffe, or at least even on their website, her job as a social worker is 20% funded by opioid funds. So obviously the city of East Hampton finds other ways to support it because she is a full-time. Are you full-time?
Yeah.
Actually, you are full-time. So that was one of my questions. So yeah, lots of great questions about where would this sit, what, not to duplicate anything, what's already there, how would it fit? And we alone probably can't make it happen without some conversation with Quabbin Health District and others. But really, yeah, really good points to think about.
What do we consider
Other
opening
questions?
to other communities that are part of Quabbin?
I guess it's a good question whether Quabbin Health would then also be willing to think about any other communities that are not officially a part of Quabbin Health District. For example, like you guys don't cover Granby, right?
Correct.
Granby is often kind of floating out there by themselves. So I don't know, Neil, it's a good question. I think when we hear more, learn more about the model, then, what might be the possibilities for bringing this to towns that are not yet covered under any of this.
And then, who applied for this grant, and then who developed this position? Like, did they just sort of hand this to you and said, "Go for it"? Like, what? If we're gonna start this, and this is our idea. I don't know how to say go for it. Like whose idea and whose vision, and how has it gotten where it's gotten?
So, Paulina Matusik, the health director over at Ludlow, took over this Public Health Excellence Grant, I think, in fall of 2023. And she really helped build it up to what it is today. She's the one that saw the needs in these communities. I think there's probably recommendations from the state with what kind of positions that should be hired, such as a health inspector, the shared services coordinator, a public health nurse, etc. Ashley was a rarity in that they really didn't advertise for us to get a social worker. That is something that Paulina saw a huge need for in these communities and really, really pushed the state to get that position approved. So at the end of the day, she is the thank for this position. And now I feel like you see them everywhere. I feel like they're popping up all over the place, which is great because there really is a huge need for it. So yeah, does that answer your question?
Yes,
Does
thanks.
that help? And just so everybody, if you haven't met Paulina's like the Andrea Creek
Yes.
of the Milltowns Public Health multi-town thing, right?
And she's
I know, it
very
does get
pro
really confusing.
going out to the community, from what I understand.
Yeah, absolutely.
Yeah.
Thank you.
So we're
Other questions?
thinking, envisioning that this would come out of be under the Quabbin Health District, but would it have to?
I'm not
If
sure.
the
what
Quabbin
that
Health
would be.
District isn't interested in getting involved in
It's a good question.
social work
Right.
or
What other-
whatever,
Yep.
then what would Plan B be as far as who would own this like who would be the supervisors and so on.
To put in 2 cents about that, I know libraries have started thinking about hiring social workers and having a social worker on staff. So if that's, you know, maybe a avenue that you guys can think about and look more into if you desire.
Cool, okay. And Neil has brought to our attention, you know, PDs sometimes also, police departments will have a social worker. I think it's a really good question, Jill. Maybe we ought to then, as a committee and as we start to talk to people, then think about multiple options for where this could be situated.
Yeah.
Your model is a health department. Libraries, that's a new one on me. I hadn't heard that before, and that's really interesting. Given the position that public libraries are in, to see people coming, going, doing what you do every week as drop-in hours, you know, more and more. Wow.
Sounds like the senior center would be a good.
Senior center is.
I would say my only issue with the senior center is you're adhering to like a very specific population.
Oh, that's true.
Correct.
Right. Their
Right.
services
Okay.
are designated.
I'm all
For
for
that
the senior
lane,
center,
yeah.
like having someone like
As
that on
that makes
staff,
sense,
but with the opioid funding, I feel like you're trying to branch out a little bit more than just that.
Here's another.
Unless it's specific to them being affected
Of
indirectly
course.
by SUD, I mean, then it's, you know,
Yeah.
it could be there,
Yeah.
do you know what I mean?
Oh,
So
yeah,
that's the thing,
absolutely,
like,
yeah.
you know, making the resources available, at least in the community, because, you know, yeah, I get what you're saying, it's not specific to seniors, but we do have caretakers in our community that are grandparents. And so opening up those services there would be, you know, maybe once a week, you know, whatever it might be, what we
Right,
would
whatever
plan on
it is,
it.
right.
I
Whether
feel
or
like
not that person is situated and an
Right,
employee
right,
Yeah, I was
of
gonna
the
say
senior
at that
center
point,
or,
right,
Yeah, yeah.
or the
It
health
wouldn't be
drop
like
in.
a big investment,
Right,
but
right,
like, yeah.
right. Neil, did you have a thought about other places where a social worker might sit if Quabbin Health District
Perhaps the
Prefers not
Belchertown
to?
Housing Authority,
Yes.
housing?
because they're regional as well, and they're different region.
What is their region?
Their region is Amherst and Hadley, I think.
Amherst and Hadley, yeah. Okay. So I think it's a really good, you know, for us. And I guess if I project, you know, down the road where if we as a committee see ourselves, ultimately we gather all this information, we like this model, we have a proposal, we get the partners in place, then, you know, bringing it to the select board, thinking about, you know, how we might ultimately do that. But I think all of those logistics have to be, you know, sort of in place. One question I have for you all, and maybe, you know, Paulina has some thoughts as well. If this is 100% funded on this grant, what's the sustainability of it? How, you have an opportunity to go for this grant again?
That's always the big question. We will see. Ideally, I think that they want us to start looking at outside funding opportunities. That's definitely just, I guess, our funding as a whole is definitely a hurdle that you have to overcome, especially when it comes to pay raises and cost of living increases. Those are things that you don't necessarily think about right away. I know that you've run grants before, so I like to think that you know what you're doing. I know you know what you're doing.
Sometimes not, but that's,
But obviously those are like big things that you have to think about.
Right. And I think even if we were to look at something that, again, might serve Belchertown and maybe other towns with the health district, you know, everybody has to think about sustainability, even though these opioid dollars kind of go for a while. You know, it's different amounts of money at times, each from year to year. So yeah, how do you pay for it? This group, you know, we've also talked about, hopefully whatever we advise the select board to invest in isn't like a one-shot deal. Like it just doesn't happen for a year or two. It's like, can we think about how we keep it going? Not only with opioid funds, but maybe other funds as well. Other questions from the committee? Let me stop yammering too much. Questions from the committee about, I want to just take a look at some of the things that you talked about. Outreach, not duplicating, no counseling or therapy, which I think is,
Well, I was going to mention, I guess you have to think about if you want to, like Ashley's is LCSW
LCSW.
versus LCISW.
Okay.
And if you have, CHD working, obviously there are more LCHISWs. But, is it necessary to hire someone who's going to do counseling? Probably not if you have CHD already, but, just food for thought when it comes to looking at those qualifications and licenses.
Right. Yeah, I think that's a really good point to be thinking about. So Ashley, with your credentials and your work, do you have to be supervised by a social worker or no?
So in my position now,
Yeah,
no.
okay.
But in some other positions outside of like that's a grant and elsewhere in other organizations, yes, depending on
Yes.
the work you do.
Okay, depending
so
on
like
the
I
kind of
wouldn't
work.
be able to provide therapy unless I was supervised by like an LI who would sign off on my hours.
Gotcha.
But in my position now, I don't need to be
Okay.
supervised by
Yeah.
a social worker.
Yeah. Just a question that I have for our committee, remind me so somebody who needs counseling and therapy in our community, where are they typically going? What do we have in our town?
CSO, right?
We have a CSO branch in our town?
Is that who we're connected to? Who are we connected to?
Oh,
for-
down by the court?
Yeah.
Oh, okay, so
Well-
there's a,
Well, no, that's just treatment.
That's more like MOUD.
Yeah.
Okay.
That's
So,
really like,
right.
yeah.
So, I don't know if we
I
have
know.
any resources in Belchertown.
I was gonna say, what do we
Unless
have
there's
right in
office-
here?
What about for Handle with Care? Who are we connected to with that?
The schools.
I know, but we're connected to an organization, a mental health organization. I think
Oh,
it's
no.
CSO.
Okay.
CSO, okay,
I
so there
think.
might be some linkages there.
Do you know Taylor?
I don't.
Emily, were you thinking about, I'm trying to think again, provider
Well, we have Behavioral Health Network in Ware.
Right.
in Ware, okay.
But that's really the
Is there
only.
are there any
It's
are there
really-
private
it's
therapists here in
It's
Belchertown?
really hard.
I know,
Yeah.
I was
I mean,
gonna
I'm
say,
a
it's really
pediatrician. I
hard.
give them psychologytoday.com and I say,
Yeah.
good luck.
Go look, find,
It's
right.
really hard. We do not have a one-stop shop, like a clinic.
Yeah.
Or
Right.
we don't. There are some in Ludlow. There's some in Wilbraham. A lot of our
Independent.
patients sort of cross.
A lot of independents in the
Right.
area.
A lot of
Yes.
independents. Yes,
Independent
there's a few
therapists,
that are this one person, that one
Right.
person. They're often full, not taking patients or insurance issues. They
It's hard
only
to
take
get
these
everything, so.
insurances, and no insurances ever match up. So we don't have a lot of resources in this community.
Community itself, right. So as you both are talking though, then one question for us to think about, and again, thinking about whether we're talking with Quabbin Health District, library, PD, housing authority, whoever, might be a key partner. Do we need somebody who's doing counseling or not? In a lot of ways, I could see where that frees you up to do the kind of community-driven work that the health department identified as needed, where
From the
given the demand, your time, if you were providing counseling, I'd worry that your time would almost be completely sucked up
It would be a
by
full-time
by
job.
counseling
Yeah,
and
doing that,
therapy.
yeah.
Sorry.
So I know in cases where, law enforcement's involved and Heather makes a follow-up, I know several times where she's actually been able to make appointments and schedules and stuff with people.
Okay.
So, it's not in town, but
Right.
she's able to access further care
Right.
for
Yeah.
people.
Right.
Well, and that may be one of the things that
That's
our
what you
person
do.
in your role would do is have these people that you can
Right.
say, okay, I need somebody who really needs therapy within a week or two. Let's get you in, and you have direct contacts, and that's
Right.
part of it is
Right.
making these
Yeah.
contacts so
Right.
that you
Those
can get
contacts,
somebody
right.
to
Yep.
somebody wherever that is.
Right.
Ideally, not too far out of the
Right.
sort of scope of where we live. Unless they have access to Zoom and they're willing to Zoom, although I think therapy that way is less effective. But if that's all you got, that's all you got.
And I think I mentioned, because we have a partnership with CHG, so I have, like you said, the direct contact that I can reach
You
out
can
to. They're not
refer,
in Ludlow.
right.
They're at the CPHC in Chicopee. But they're able to, call the individual directly and kind of streamline it
Right.
faster, hopefully.
Right.
By having that direct person rather calling the main number and waiting, and then it's
Right.
a 4-week wait list, so it's
Right.
good to have that direct
Right.
contact.
Right.
You can sort yourself out by that point.
Well, and
Good questions, yeah.
maybe that's a different thing to look at is getting some sort of therapists that are here, that are local, that are is that
Interesting question, yeah.
we all know that substance use disorder, there's often an underlying mental health disorder. So do we head this off at the pass for some of the people that are heading in that direction by getting therapists in our community who are readily accessible and available. And then for those who have already gone down that road of substance use disorder and need mental health and care, therapy, do we get them involved? If maybe with, again, these kind of towns get some sort of a umbrella that does these couple towns and have a local building facility group. I don't know.
Out of curiosity, do your school systems have counselors?
They do.
Okay. I was gonna say that could be an option as to hiring a counselor for the school, but
Right.
They do. Yes, they do. So there's like guidance counselors, and then there's college counselors, and I think
They
We do have a social counselor. We have a social
They
worker,
do.
a
They
social
do.
counselor.
I don't think kids like going to them. I don't think that I think there's a stigma to going to counseling during school hours, to going to see the counselor. I just think it is a possibility. It is a resource, but I don't think it's utilized all that well, and I don't think that the kids are so agreeable to it.
okay, that's fine.
Yeah, it is one option.
Yeah. I have a lot of
So-
friends that are like school counselors, and Fran and Ray both have jobs, so good for them.
So I'm making a note, Kim, what I'm hearing too is, we're hearing about your model where counseling or therapy is not involved, but you're also raising the question as a committee, might we want to explore?
Right, completely
whether-
different
right,
option.
Completely different option.
Is that
like,
something we want to look at?
that we would say, opioid funds might be appropriate to support something to do with more availability of therapy and counseling right here in town. So yeah, sort of separate, but it's really good to hear the differences there. Other questions that people have while we've got the experts here who are doing an enormous thing in 4 really different communities. As Emily well knows, the communities, multiple different communities.
Are you aware of the
Questions?
crisis for veterans, like group that's going around?
Oh, with Thea, is
I
that?
think so.
So,
It's
yes.
Ludlow, Belchertown, Granby, South Hadley.
Yeah, I know Ludlow PD is involved. I don't really have much involvement with it in the sense of just.
It's just, I guess it's just forming, just a heads up that
Yeah.
I think they're gonna try to ramp up their, getting a lot of the veterans agents.
Yeah, I do know a couple
Working
of the
on it, so.
Ludlow officers mentioned it. They started it up, which is great.
So it's a special like
Yeah.
crisis team that it's usually the law enforcement that we're now trying to recognize if somebody's a veteran.
Okay.
And actually veteran services can offer a lot too as well, and sometimes a veteran will connect better with those services. So.
So thinking about how to better serve that particular segment of it.
And there's already
Right,
existing
right.
stuff in place,
Right.
whereas, like we're talking, there's nothing in Belchertown at all, but there is actually stuff for veterans.
Right. As you were saying that, Neil, when you said the word crisis, it brought a question to my mind. What happens when it's evening, weekend hours? How do you, is it mostly, people are gonna call or email, or you're gonna get a referral? What are kind of the hours?
Monday through Friday, so town hall hours is what I work. Yeah,
Okay.
so it's clear for to the police departments and the fire departments. I'm not crisis. CHD or wherever is
Yep.
where you'll be calling
Okay.
for crisis. Or doing section 12s or whatever they have to do.
Yep.
So individuals can call me, text me, email me, drop in at the town hall. But yeah, Monday through Friday we're town hall hours.
Which then sounds like those weekly meetings with the PD and the fire department are really helpful, because then you learn about something that might have happened on a Sunday night when they're not in town hall. Gotcha, okay. Other questions about the model, the data? Who else do you all think we should talk to? What other questions do people have?
I do know that Liz, she may mention this, she's
Yep.
trying to start up a group for Western Mass social workers.
Ah,
So I know
okay.
there's like Kim Slade, I think she's the
From Westfield?
I don't know if you guys.
Westfield, yeah.
And I know there's a social worker up in Pittsfield, Maria, I don't know her last name, but there's just a couple other individuals. I can get you that information, Gail, if you
Okay.
want. Just because, like I said, in my role, I was just trying to talk to everyone and kind of see what to do.
What
We're still
they're
figuring it
doing.
out,
Yep,
but
yep.
that's me and my social work side of
Okay.
things. I don't know if you
Great.
think there's.
No, I don't know.
A general question, as far as like the market for social workers, is there a lot available now, or is it a very few
good
that actually are
question.
looking for employment at this point?
I feel like I mean, I can answer half of this, I guess. I feel like I've noticed, like I said, a lot of health departments now hiring for social workers. I check the MHOA website just to see like what's out there, who's hiring for what. I feel like they don't stay up long.
Okay.
So I can only assume that they're getting filled.
Okay.
I feel like I'll see them once and then I check back in a couple weeks and they're gone.
Okay.
So.
It's a different type of social work too. You know, I didn't come from
Right.
the community background of doing so. You know, I was kind of just specifically substance use, what I did in my previous role. So I guess it depends on like what you want to do. But I do know like there is positions and they go pretty quickly. What we see, I just don't know if it's a hot topic or not.
Do you work with your court system at all?
No, not directly. I mean, I would go down to the courthouse and support individuals with paperwork, stuff like that, but I don't have like a direct
So that's
relationship.
something that I know is a need in Belchertown, is to have somebody down at that courthouse. I'm working directly with the chief PO down there, Kirsty, and they definitely love it when we bring information down from like the Family Resource Center from Ware, or the Recovery Center of Hope, or whatever, you know, any, the connector information, like we go down there and put it out in the front now. And I was just down there last week and they were like, Chris, please keep bringing stuff, because people take it when they're around, and they're like, one of the biggest issues that they have, is transportation. Because people go to court and they're coming from other towns. We don't have Uber, we don't have any of that stuff around here. If you do the connector thing, you gotta call 48 hours in advance,
And they might not be available.
and it might not be available. So I know that is like a huge problem with the court that we have right now. But also just having somebody there for people to connect with resources and stuff is an issue. I've given them tons of resources, and I'm doing a training with them on April 4th, and we're doing like it's a watered down version of like youth mental health first aid. It's just mental health first aid. So what I did is I tweaked it and made a 2-hour presentation just around like the LG action plan, and you know how to implement the LG action plan. And we're gonna go over like you know what happens if you have an overdose, and like I'm gonna give them some Narcan, and or do they don't have an naloxone box down there, do they, at the courthouse? So Christy's gonna be checking on that to see if we can get one down there with her people, because she has to get permission, and then we're gonna get one down there. So that's something I've been working on.
They still have some at the Recovery Center from Healing Community Study that you could use down there.
Yeah, we have tons of Narcan left too in our office as well. So, but you know, these are just another aspect to look into where we could use help within our community for sure.
And you know, as you're saying that, I'm sort of thinking a little bit about, you know, it's going way down the road already. We're just starting to gather this information. But if we are going to be in a position to recommend to the select board that a position be created that does not exist right now, at least within town government, as well as, you know, whether we're recommending opioid funds be used for it, whatever it looks like, then I think we, correct me if I'm wrong, those of you who know better, but I think we'd have to work with town human resources. I assume Ludlow Human Resources had to be involved with a job description, pay scale, all of that kind of stuff. And whether we're involved with that or not, I don't know. But ultimately, what we're learning today is about a position that currently doesn't exist that we might suggest be strongly looked into.
And that could, if the town is going to be the umbrella, then that needs to be done, and that could be done ahead of, you know, if once we know exactly what we want, ahead of the hiring, like ahead of, you know, it's better to have it and not need it than need it and not have it.
Right.
So.
I agree, yeah. I think our select board, you know, welcomes as complete a project as possible, so that, you know, they have, cool.
Chris, back to the courthouses. I know like there's recovery coaches a lot now in courthouses and stuff, in the courtroom and stuff like that. I know Holyoke partners with, I think, Indara to have the recovery
To have
coaches
the
at court.
coaches there, so.
Kind of back to what you're saying, having those resources
Yeah.
available at the courthouse.
Right, so court system might be
Yeah.
another.
Yep.
And again, we can also, talk with Liz a little bit as, just with her job description, similar to yours, trying to connect with existing committees, existing groups, existing services, and knowing the courthouse is right here in town. Yeah, thinking about how that might be another place for information and outreach. Other questions from our Milltown buddies?
I have your email, so I'm going to be sending you guys, even though you don't serve Belchertown, our Umbrella Wellness Fair. This is our pitch. Kim's on the committee as well. So this is our 4th year doing this. We usually get over 50 plus nonprofit organizations tabling, so it's a great opportunity for you guys to meet other organizations. I know, Lauren, you responded back to me, thank you. And for you to meet other organizations. We have tweaked it over the last couple of years. Last year we had it was way too spread out and way too long. And so this year we're doing it May 17th, 12 to 4 p.m. And 12 to 2:30 we're going to have the tables in the gymnasium at Chestnut Hill Community School. We did it outside in the past, it's just too spread out. So we're doing it in the gym. We have a hidden in plain sight trailer coming. We also, from Alex Fisher Foundation, we have the Barrows Family Pulling Team pulling for a cause, which is suicide prevention and anxiety, depression information. And then we have Vibe 18 coming, who's our main stage speaker. And they'll be going on from 2:30 to 3:30. So what we're doing this year, because in the past we didn't do this, we're going to ask the tables to shut down at 2:30 because we want everybody to come into the gymnasium, not the gym, the auditorium, and see Vibe 18. They are awesome and they're so much fun and energetic, and it's gonna be great for the community. And we're hoping that a lot of young people go because they're gonna be in the schools the day before. And Jake is just who runs it. He's just so engaging. We already know youth are gonna come the next day, so we just want to make it a big event, because in the past tables are well, do we table or do we go? What do we do? So we want to make it really clear this year, shut down at 2:30. If you don't want to shut down, please stay. Just stay at your table till the end. But we want to give everybody the opportunity to be able to do that. So then at 3:30 we do raffle giveaways, and in the past couple of years we've had 60 plus raffle giveaways, which is insane. But so then that's kind of the gist of it. We have kids activities, and things like that too. But the flyer will be coming out mid-March.
Okay.
But I'm gonna send you today. I guess if that's I don't know.
You can send it to her.
But I'll send you an email today. Just put you on the email. Let's send you the invitation, and then I'll send you the flyer to everybody when it's.
You said May 17th from noon to 4, right?
Yes.
Perfect.
Yeah.
Thank you.
Yeah, we would love to have you guys. So.
Yeah, send it
Great,
along.
thank you. And also, we are doing another thing. I'll send you a flyer on. The Voice of Recovery Matters is coming up on March 11th, and it's through the Municipal Vulnerability Preparedness Program 2.0, which is in our town, and also the Belchertown Council on Aging Senior Center. And both are collaborating, and we're putting on a catered sit-down dinner with your choice of a chicken dinner or vegetarian. They do have everybody who registers gets 10 free raffle tickets for prizes, which we have gift baskets, $25 gift cards for Stop and Shop. But you have to register through me, so it's on the flyer. Everything's on the flyer, but I'll send that to you too. So if anybody. We're just looking for voices, and it's people that are directly or indirectly affected by SUD. Get grandparents, like I said before, parents, family members, siblings, friends. It could be anybody. So I'll send those two things to you today.
Great. Cool. Thank you.
Great, thanks, Chris. I know, we in our area here we talk a lot about how hard it is to get around, but I also know there's a lot of connections between these communities. Belchertown family, people live in Ludlow, your cousins in Ludlow, your aunts in Granby, whatever. So always looking to share, information across the region. Cool. Any other last questions for Ashley and Aaron, we can let you
I
go.
was
We
gonna
know
say,
where you are. We'll
If you
find you.
think of anything last minute,
We
you have
will.
our emails. You can reach out anytime.
Right.
We'll answer your questions.
Great.
Because I know you always think of things after
After
people
you
leave, right?
And we'll all process and think about what we learned today. Like I said, we'll hear from East Hampton probably at our next meeting. See what, what they're seeing in their community. So this is just super helpful to hear from you all. Thank you.
Yeah,
again.
thank you so much.
Bringing it to our attention. Thanks.
Good luck. Keep us posted.
I know, we will.
Yeah.
Yeah, I'm
Thank
excited to see.
Thank you for paving the way.
Yes.
It was not easy to convince a health department that a social worker, a state health department that a social worker should be a part of a health department.
Yeah.
Thank you.
Thank you.
Thank you
Bye.
very
Thank you.
much. Great. All right, it's a little bit before 11. Just a couple of other things on our agenda that I wanted to check in on before we adjourn. Just to let everybody know, just because I thought it might not be a bad idea for our presence to be briefly at a select board meeting, because we haven't been there in a while. They haven't seen us. I reached out to the town manager and the select board chair. So folks are welcome to join me. It looks like we're going to be on the March 17th, that's a Monday night, agenda. I asked for just a really brief appointment, 10-15 minutes. Here's what we're exploring, here's where we're at. Not bringing any specific proposals to them if we don't have them, but just to kind of give them a heads up as to where we're at, and remind them as well that in some ways, and if we're not ready, we're not under any specific timetable, but in some ways it might be helpful for us to be thinking about, do we have specific proposals we want to bring to them before the end of the fiscal year? So that would be before the end of June, so that they can consider where we're at. But again, I don't want to rush anybody.
Did we get the application from
Honest Beginnings? I haven't seen anything. Anybody seen anything? No? Maybe we'll touch base with them one more time, maybe before that March 17th, just to get an idea if we're getting close to a proposal that we could then go to them with anytime. Particularly because we recognize we already support the idea of helping with those fees that folks using those services need to pay. So that's a good point, Kim. Let's we'll check in with Honest Beginnings. All right, great. I'll make a note of that. But March 17th, once the agenda is posted, I think we're likely to be early on in the agenda. They tend to do the appointments early and then get to their other business. So I think their meetings start at 6:30, if I remember right.
Yes.
All right, so we'll keep you posted on that once we have an agenda. In the collection of papers, various around, is information. Thank you, Jill. I don't know if you want to say more about some ideas for our page on the town website.
I just put something together as far as language and so on, what was in my thought process about what we needed to have on the Opioid Settlement Funds Advisory Committee page of the Town of Belchertown website. I just wanted to kind of get started. So if anybody can review, and if you have other things, if you have suggestions on local area resources, like I want to link things.
So I'm gonna tell you for us, Aline put together like a 4-page thing on resources, and I put together I have actually a spreadsheet with the ones that there's like 100, close to 100 organizations that we are directly connected to, and so I'm gonna give that also. That's all going to Karen Nato, and so she's gonna have to put all Karen.
Kate.
Huh?
Our
Karen.
communications.
Yes, it's all going to her. All this information that she can link on the vote page. page, and then maybe you guys
can
can
link
link
it as
that
well.
when you look
Okay.
at it
Yeah.
back to our page or something like that, you know what I
Okay.
mean? So,
Good.
Yeah,
but there
keep
is
me
like
posted.
so many resources that she's
Yeah,
gonna have to
keep
input.
us posted on
Good.
all of that.
Okay.
Yeah,
Um,
it doesn't seem like there's any need to start from scratch with
No,
the
no.
resources.
No.
Okay.
Right.
So, like I said, if you guys can just take a few minutes to review, and anything that pops up into your mind, we can kind of talk about it a little bit more, or put more together. But I think it would be a good goal to get this done in the next like 30 days or so.
Okay.
At least a start.
Some stuff there. but-
Did you wanna put who the committee members are on here?
Possibly.
I don't know, I just thought it might be a good idea, make
Yeah.
connections,
Uh-huh.
just to, in case somebody has questions, they can reach out to
Questions,
one
yeah.
of us anyway.
All right, so it sounds like if folks take between now and our next meeting, you know, as a little bit of a homework assignment, review what Jill put together, and then thoughts about, you know, anything to add, anything that, or ways to streamline doing this so we can borrow from other places, that would be great.
I think one of the important things, just reading the background of the opioid settlement fund statement there, if we're going to propose in the future a social worker, we have to find a very direct correlation of the social worker, and the main purpose of the settlement fund is to address and mitigate the harms and impacts of the opioid epidemic in the Commonwealth.
Right.
I think we need to be very specific in how we do
Right.
that.
And I would also say that when you have a chance between now and next meeting as well, take a look at the more detailed job description from East Hampton, because I thought they did a nice job of making it, linking it so that they could justify why opioid money partially supports that position. But you're absolutely right, Neil. Any of what we're talking about, we gotta make those really clear connections in order that everybody is, you know, nobody gets in trouble for using money in a way that you're not supposed to. So, good point.
Then Tom got
Yes,
to
do
me,
you wanna
okay,
give
so
us an update on the
James Brook
school?
Middle School, I did reach out to Tom, and he got back to me and said that the, even though it was successful and everything, that he is going to not, fund it again next year.
Not need.
He said he would explain it when he comes, but I have not heard anything. Did he ever get in touch with you?
Other than the email that
Yeah,
I
he's not got back in touch
I'll
with me
reach
after
back
that,
out.
so.
I'll reach back out. Maybe we have
I mean,
him.
you would probably be better. He like ignores, like if
Okay.
it's somebody from the school, he'll get to it when he gets to it. But if it's somebody outside of the school,
Okay, I'll
he'll get to it right
I'll
away.
get in touch with him.
So basically, yeah, he just said that they're not going to seek any more funding for next year. And on that note, I'm going to bring this up, which I just talked to Neil about. So I just looked at our notice of funding. It's not come out yet for drug-free communities. They moved us under the Office of National whatever Prevention Injury.
It's always been there.
I thought it was moved.
No, we've been under injury, the drug-free communities
I
has
thought
been
it was
under
moved.
injury prevention for several cycles.
I thought it
now.
was under Office of National Drug Control Policy.
It is partly there, but it's also under the CDC.
Oh,
It's a
okay.
shared,
So it's shared.
it's a shared.
Because I noticed that today, and
agreement.
I'm like, did they just move that? But so the notice of funding hasn't come out yet. You know, it's gonna be March soon. We need to know what we're doing next year. So with that being said, I'd like to take the application and give it to Sean and Brian to fill out for us. For
That's a
Aline
good idea.
and I both for funding next year. We talked about
This is
doing.
for the same funding that we did this year.
It was, you know, we talked about the gap year already, as a committee. You know, I have to step back from it, obviously, but with us talking about the gap year already, we can go and move forward with the gap year. I do think the notice of funding will come out. I have a very positive scale, I know, but I'm positive about it, but, you know,
What is the notice of funding? That means that they're going to
that they're
for the
gonna
next
keep
5
the
years.
grant
And
for
then
drug-free
keep the grant
communities.
for at
But
least for
but
5
why
years.
I'm positive is just because of what I heard at CACA, and also I did look at like, and I know it doesn't mean anything, but like the CDC website, if you look under drug-free communities, if you Google it, it used to come up with this site is being under construction. It's not under construction anymore. if you scroll down, we are on that website, vote as a success coalition still.
Yeah.
But look at Gail.
It's a longer
Oh, yeah, I
longer
know.
story. We're all waiting to see when it comes out. It's
Yeah.
already 2 months late. now,
I know, but
I
look,
know.
with the country is a mess
I know.
with
It's
everything.
It's
So,
Oh, I didn't notice.
all
yeah.
federal
So
funding
with
is,
wait. With that
anyway.
being said,
Yeah.
we don't know. There's an unknown, and we
Yeah.
need security. So, at least if we have a year, we don't get the funding. We have that year to look at other
Yeah.
possible funding resources. Now, if that does happen, there's a couple things. You know, do we want to? If we don't get the funding again, do we want to create this position into something to integrate what we were just talking about with not necessarily drug-free communities, but like kind of integrate both positions together?
I think it's a little too early to tell.
Right, exactly.
So I
like,
guess
we don't know. Yeah.
what I would suggest the schools do with their drug-free communities grant, and maybe I'm more pessimistic than I need to be, but I think you put a proposal together as if there's absolutely no drug-free
Right.
communities money. Your grant currently ends at the end of September.
Mm-hmm.
So put a proposal together that would cover you from September to June of next year, and also maybe
We go September though.
well,
When
you
we
could
do
do
the
it that
grant.
way.
We do.
You
That's
could
what
do
we
it-
did
you
with
could do it
the
that way,
additional
but-
7
Yeah.
hours.
Right, you
We
could
did
do
the
it that
7.
way.
We did it that
Sure,
way. So we'll do it.
That's
So
fine.
with that, do we need to do 2 proposals?
I
then?
think you, personally, I think you do. I think
Right.
you need to have a proposal
for the
if your drug-free communities is funded, and if
and
it's
the
not.
7 hours though. But yes,
Yes.
right.
Yeah.
Um,
But
What
no,
would
but
you
we're gonna
ask
have to
for?
we're gonna have to submit the 7 hours anyway. But
Right.
we'll so the drug. Okay, we're gonna have to submit one no matter what. That one
Yes.
7 hour one no matter what.
To keep doing what
Right,
you
right,
were
right, right.
funded to do, right?
Right.
we QHSUA will also be applying for the SAMHSA SPF PFS grant. Didn't just come yet. It's due March 18th.
Mm-hmm.
And under that currently right now, Belchertown is one of our catchment areas, but I was going to ask you afterwards, but not since we're talking about
Yeah.
grants, was if you would want to be a subcontract underneath that prevention grant.
Yeah.
And then that could help
And
fund
you could
your
think
position
help fund some stuff, yep.
as well.
Yeah. I would do subcontracting anyway on the
Yeah.
side. I mean,
That's
mean,
probably an offline.
Yeah,
more
yeah.
off, right, you guys
Yeah.
talk about
But
that.
just
yeah.
but
But
we
in
can-
terms
yeah,
of,
we
in
can
terms
talk,
of
yeah.
this committee,
yeah.
I would, like I
We
said, I
do
would
separate
encourage you to
ones.
think
Yeah,
about reapplying for what you got,
Okay.
what the schools
Alright.
were awarded already.
Mhm.
But just to have in your back pocket an application, should your drug-free
Yeah.
community, even if it's,
But do we want? So we're gonna put that together like soon, and then we'll present it sooner than later, so it can get accepted. And then if it doesn't, we don't use it, then we don't use it. Because I'd rather have us put it together before
I think
even the
better
notice
have
of
it-
funding
yeah.
comes
Yeah.
out. Like
I
I
think
don't.
having-
I just
yeah.
want it to
Yeah.
get done.
Yeah.
And on
can't
that,
hurt.
with
Can't
that
hurt
being
to have
said, with the budget, all right, and this is something maybe you and I need to talk about, Jill. Within that budget, if it's drug-free, covering drug-free communities, I have like, do you want me to do a matching on that, like drug-free communities does? Because we do have matching funds on there, and
We can talk about it after.
Yeah,
and
we
then
can talk
we have to
about
figure
it.
out like, do I have to rent a space? What about technology? What about media? I know, Jill,
Right.
I know, but I'm just putting it out there. We already kind of mentioned that.
It seems like schools and maybe town have to talk a little bit more. So what does it
More
look like
specific.
if that drug-free communities money is nowhere, is not available?
All right. So maybe should I set that up with you and Brian and Sean?
Yeah, let's talk offline.
All right.
Okay.
I will say we're looking
Alright.
at something similar in Ware for my position in
Okay.
case the SPF doesn't go through.
Okay.
It's like gap funding for me, so I stay in my position to look for future funding.
Right.
And we're going to present that to the select board hopefully soon, but we are looking in the same.
Yeah. Yeah. I
For
think a lot of
opioid-
towns are
for
in this
opioid funds,
in this
right,
situation.
in that same situation. All right, so middle school not applying
How much was their funding last year?
What?
for
Remember,
the
for the middle school?
I was
middle
gonna say
school,
50.
50,000, I think, yeah, that sounds right.
So,
So with that application not coming in, we don't have, yeah, that won't be allocated.
Okay.
Right,
50,000, yeah.
right.
Do we know what we're
It's a
getting
nice
from
little counselor.
this year from the settlement?
That's a good question. Maybe Jill at the
I'm
next
sorry,
meeting,
what?
where we're at, maybe a dollar
The
figure as to
same,
where we're at.
I printed it today.
Oh,
It is, we are
great.
still at $336,000.
In the
um,
coffers, good.
I'm expecting that we will get, I'm gonna guess around 75,000 more this year.
Okay.
I'm gonna guess. Last fiscal year, we got 2 deposits, one in March and one in May. And we've received 1 or 2 already in this fiscal year. That seemed to be different than what those last year ones
Okay.
were. So I'm expecting that we will receive more during this year.
Yeah.
Good question.
Yeah,
So
sure.
we have a fair amount, and again, knowing that after-school program won't be asking for
Right.
that chunk.
That's a shame.
I'd really like to see Honest Beginnings.
I know, I think if we can get Honest Beginnings to request some of those dollars, you know, if schools are looking at, again, both the additional hours currently funded, we apply for that, but then also think about an application that might not even ever have to be used, but at least you have it
Right, exactly.
to cover. And even if the funding announcement comes out and you apply,
Right, exactly.
and you don't get funded through
Right,
that,
it's
you
still-
have a
it's
gap
still
year,
there,
right,
it's still
right,
there.
you have gap year money to cover it
Yeah.
all. I know, it's a lot to think about. We'll see. It's very hard to know at this point when you're talking about any federal funding that's health related, so
Yep.
tricky. All right, last but not least, just a reminder, we have our meeting again Monday, March 24th. Is that February is the even month, so an absolute 4 weeks from today. My question is, do we want to set our April meeting? Are we wanting to look at a Monday morning again for an April meeting, just to have it on the books so that we can plan ahead?
I forgot my phone.
Thoughts, comments, Monday morning?
What date would it be in?
Let's see, so if we're looking at, we're at the last Monday of the month, right, today. The 4th Monday of April is the 28th?
Niels, do you have this flyer?
Good,
That works for me.
good,
Sure.
Where did we get it?
I
good for
printed it.
everybody?
Can you send it to me?
So April
And then we can
28th,
post it,
okay.
instead of scanning it, if you could send it to me, I'll just
At
post it.
10 a.m., same time, same place. All right. Any other suggestions for anybody else to invite? So March, we're going to hear from East Hampton people, hopefully, about their social worker program and maybe the police embedded social worker. So we'll do all East Hampton next
I'll
month.
reach out to Emily then, the one that's in the police department.
Okay, cool. Anything else for now? You got stuff to read, website to think about, job descriptions and other social worker related materials. Anything anybody comes across that you think would be really helpful to share with the committee? Feel free to just, send a link or a document or whatever.
Oh, we should talk to Andrea
Yes, at some point, I think after we hear more about
for the share.
social worker things, we bring the Quabbin Health District in.
Yeah, I
for a
can't see her being
conversation.
against it.
No.
I think she'd be for it. It's just whether they have funding.
Can we ask her to come so that she hears East Hampton?
Ooh, there's a thought.
Yeah, so
Yeah,
that
have her-
she
that's
has
a good
it
idea.
as a
Thank you.
firsthand.
Thank you. Yep, good idea.
My other question is if we're gonna start partnering with the Quabbin Health District on this, should we also be inviting Quabbin, or at least the Ware Opioid Settlement Fund members possibly?
They don't have their own. It's just the select board.
It's,
Okay.
we don't
Yeah,
have
they
to,
haven't.
right.
They haven't created a protocol really.
It was
yet.
just an
How
article.
about the town manager, could
about
Yeah, we
people
could get Stuart
using
here.
their funds.
Not just so we can hear it out.
Yeah, Stuart would probably be a good one to bring in,
Okay.
and also for him to see this process. Because I'm like, the way you're doing your opioids right now is
Yeah, okay.
gives me
I-
anxiety. There's
Yes.
no protocol.
I know,
in place.
there's no protocol, and I will say that I have been asked to go talk with the town manager in Ludlow for them to think about this kind of process. So Belchertown is a good model. I know I'm biased.
Yeah, I talked to
But-
Sturbridge last year.
but-
I went and
yeah,
presented at Sturbridge.
Yeah, great. All right, so we're going to invite Andrea Creed from our Quabbin Health District to our March meeting. I think that's a good idea. Start the thinking about, is Quabbin Health District open to hosting and having a social worker be there, and then we'll think about what we do with our April meeting. All right, I think it's just a little bit before, after 11, I'm open to a motion to adjourn our meeting.
So moved.
Second, everybody in favor? Aye. Thank you BCTV for filming us and broadcasting us.
Yeah, so
Lots of
what is
material.
the
So this is
probably
what
because I